to Comfort Home Nursing Care YouTube channel. Today we are going to discuss how a lady with irregular menstrual cycle can calculate her window period, or the period where she can get pregnant with her irregular period. Previously, we made a video on how to calculate your window period for ladies who have regular period. If you're new here or you've just come across this channel, please make sure you subscribe to this YouTube channel. Turn on your notification bell so that you don't miss our health tips that always comes from this channel. My name is Sarah Dong. I'm working with the Comfort Home Nursing Care Services. It's a group of medical professionals. We do bedside nursing basically to patients from home and from hospital. Our services include post-surgery and wound care, elderly nursing care, stroke recovery, palliative care, early discharge from hospital, nursing consultation, physiotherapy, dementia care, cancer care, and diabetic care. If you're in need of a service that I've mentioned above, please contact us on our details that is running on the screen. Alright guys, let's go straight to discussing our topic of today, as being how to calculate the window period for a lady who has irregular menstrual cycle. So guys, on this board we have a few terminologies that I would like to define them for you or explain them for you. Number one here is a cycle length. This is a number of days in a month, starting from the first day you see your period blood to the last day before you see the period blood of another month. Already we discussed in a previous video, and we're going to put the link above here so that you can follow how to calculate or how to count your cycle length. The second one is fertile window. Fertile window, these are days in a month that a lady is able to conceive. There are few days in a month that a lady is capable of conceiving. There are also other days that are called safe days. The next one is normal cycle length. So under cycle length, we have the normal cycle length, we have the abnormal cycle length, we have irregular cycle length, and regular cycle length. The normal cycle length of a lady is always between 21 to 35 days. A normal cycle length of a lady is always ranging between 21 to 35 days. Any cycle length that is below 21 or above 35, it's always called abnormal cycle length. Below 21, it means this person always, when they count their cycle length, they always get like 18, 15, like below 21. Then above to 35, above 35 days, this one means every month when this lady counts her cycle, when the lady counts the number of days in between two periods of two different months, or it can be two different periods but in the same month. Usually, if the cycle, if the number of days is above 35, it means the period is abnormal. So let's go to irregular cycle length, the one we are going to discuss today. Irregular cycle length simply means also it is the same as the abnormal cycle length. It is the period cycle which is below 21 days or above 35 days. They are the ones that are called irregular cycle length. They fall out of the normal cycle length. Then regular cycle length. Regular cycle length, these are cycle lengths that are falling in between 21 to 35 days. When this lady counts the number of days in between her periods in a month, they are always ranging between 21 to 35 days. That is, for example, it can be 21, 22, 23, 25, 28, as long as the number of days that she has counted are lying between 21 to 35 days, we consider it as regular menstrual cycle. There is also what we call varying cycle length. Let's go to regular cycle length. This is when you count your cycle length and it is always the same number. For example, when the cycle length of this month is 28, even for the next month when you count the cycle length, it will be 28. So it doesn't change. If it is changing, it changes for a short, like for 2 days, or it can be backward by 2 days. We also have something called varying cycle length. Varying cycle length, these are cycle lengths that are varying, but they are within 21 to 35 days. They are varying. It can be 21 this month, then another month it is 35, another month it is 28, another month it is 22. As long as it is between 21 to 35 days, it is a normal cycle length, but it is simply varying cycle length. So let me take you through how a lady with varying cycle length or irregular cycle length can count their fertile window. So for those who have irregular cycle length, it is a little bit different how they calculate their fertile window. And we are going to use this calendar. I'm going to show you using this calendar of July and August. First and foremost, when you have irregular cycle length, you're supposed to monitor your period for the next 6 months. So this is how to record your cycle length of every month for the next 6 months. The first month we've recorded here is January. In January, for this lady, her cycle length was 26. In February, her cycle length was 30. In March, cycle length was 21. April, 24. May, 31. June, 28. So we are assuming that this lady, she wants to time her pregnancy in July. So this is how we've charted our cycle length. We do this because the ovulation of someone who is having irregular cycle length is also irregular. Their ovulation days change. It keeps on changing from 1 month to the other. Unlike for regular cycle length that we've already discussed in the previous video, with people who have regular cycle length, their ovulation days don't change. If it is 14th day from the day they started their period, it will always remain 14th day. It doesn't change, and it is a little bit easier for them to calculate their fertile window. So here there are two numbers that you have to take note of, and I'm going to explain it. Number 11 to number 18. While calculating your fertile window for irregular cycle, number 11 and number 18, this is a period that is called the luteal phase. The luteal phase is the number of days the woman's body gets ready for conception. It is a number of days when the woman's body or the uterus is getting ready to conceive. So this will help us in the calculation as well. So we are going to do a little bit of calculations here. We are going to get the shortest cycle length, that is 21, and we subtract 18 from it. The 18 is the luteal phase, which is the longest time the body takes to prepare to conceive. So we subtract 21 minus 18, as I've shown you here in the board, giving us 3. Then when we go to the longest cycle length, we are supposed to subtract 11 from the longest cycle length. So our longest cycle length is 31. We subtract 18 from it, giving us 20. So when that is done, you go to your calendar. Our fertile window for this lady who has irregular period ranges between the 3rd day from the day she started her period to the 20th day. So we simply go to our calendar and we look for the first day. We start charting her cycle. Assuming she saw her period on the 3rd, let's say 3rd of this month, she started seeing her period here. This was her first day, second day, third day. So we are going to name all these days all through up to the last day before she saw the next period of this month. So this is the third day, fourth, fifth, sixth, seventh, eighth, 9, 10, 11, 12, 13. You continue counting these days irrespective of the number of days she has had her period. Period days are different from cycle length. Period days, maybe she did her period up to maybe day 4 and it stopped. But you don't stop counting. You continue counting up to the last day before she sees her period blood for the next month. So let's continue counting. 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, and then we go to the next month. 30, 31, 32, let's go to 33. Now, assuming she saw her period again, she started another period in August. She started on the 5th. It means 5th will be her first day. Remember the definition of cycle length. We said cycle length is the number of days in between two menstrual periods. From the first day the lady sees her period, or from the first day you see your menstrual blood, to the last day before you see the period blood of another month. So it is simply what we've done here. We've counted from the first day she saw her period to the last day, which is 33, before she saw her menstrual period of another month. So we are going to count all these days. Let's see the cycle, what it will give us. Meaning, in the month of July, her cycle length was 33. So in July, we are going to chart here that in July, we add here in the calendar, on our calendar, that July she had 33 cycle. So how do we get our fertile window? How do we identify from this cycle the days this lady is capable of getting pregnant? Let's count. We are going to count from the 3rd day to the 20th day. Those are her fertile window. So from day 3, day 4, day 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. So from the 3rd day, when she started her menstrual period, to the 20th day, these are the days she's capable of getting pregnant. So if you're there and you're struggling, or you're trying to get pregnant with irregular menstrual cycle, this is the best method that you can always use. Make sure you watch this video slowly, pause, rewind where you've not understood, so that you get exactly what I'm talking about, so that we can all jubilate the pregnancy together. So the shaded area from the 3rd day to the 20th day, this is her window period, and she has about 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18 days. She has 18 days to get pregnant. All these 18 days, we don't know exactly when the ovulation is going to take place, so you just have to continuously have intercourse, sexual intercourse. But at the back of your mind, you should be aware that sperm can stay in a lady's body, in the uterus, for about 3 to 5 days. So it is okay when you have sex like in intervals. When you have today, you can skip like 2 days because the sperm is still alive. Then you have it another day. You can be having in intervals so that we can cover all these. But also it is okay if you like to have it daily. It is also okay as long as you are enjoying the process. So ladies and gentlemen, that was all I had for you today in this video. Thank you so much for watching today's video. Please, I request you subscribe to this YouTube channel so that we grow it together, and also turn on your notification bell. Click the like button so that we grow this channel together. Thank you for watching. See you in my next video. Bye.